Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, today we are going to be talking about two important funds that the federal government of Nigeria has provided for health. How are they being utilized? What are the recommendations of advocates and professionals on how we can make these funds to get more value for money for the Nigerian people? First is the Cancer Health Fund. Cancer Health Fund came about from, 2020 after years of advocacy by private sector members of the civil society and as well as cancer survivors. And in 2020, about 729 million naira was appropriated for this fund. In 2021, over 200 million. And of course, in the 2022 budget proposal, over 600 million have been budgeted. And this fund is meant to provide support to indigent Nigerians with breast cancer, cervical cancer, and prostate cancer to support their treatment. Definitely is not enough for all cancer patients in Nigeria, but it's a huge progress that's been made. On November 4, the Senate Committee on Health raised alarm that even though these funds have been released, the Federal Ministry of Health have not been able to disburse these funds for the treatment of cancer patients. It was so alarming and it has generated a lot of reactions and anger from a lot of persons. But some progress had been made afterwards, which we are going to hear from those who know better in the course of this program. The second is the Basic Healthcare Provision Fund, which was provided by Section 11 of the National Health Act 2014. And this fund, since 2018, there's been annual appropriations of not less than 1% of the Consolidated Revenue Fund of the federal government. Of course, since the appropriations started in 2018, less than 100% of 2018 appropriation has been released. So what are the views of the advocates, civil society organization members, professionals in the health sector about this, and how can we make this to impact more positively on the average Nigerians? So that's what we'll quickly talk about today. And I have with me in the studio a cancer prevention or cancer control advocate, and also someone who was part of the efforts to get the Cancer Health Fund. I'll be connecting via phone to a cancer survivor and the vice president of Network of Persons Impacted by Cancer in Nigeria. And of course, in the second segment of the program, we're going to listen to a vox pop where professionals made recommendations on how the basic healthcare funds can be more impactful to average Nigerians. Do stay with us on the program today. Don't forget to follow us on our social media handles displayed on your screen and keep the messages coming. We find them very useful. So we'll get to meet my guest after this break. Do stay with us. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, talking about Cancer Health Fund. Let me begin with you. Mr. Runcie Chidebe is with me in the studio. He's the founder and executive director of Health and Psychological Trust Center, popularly known as Project Pink Blue, one of the leading cancer organizations in the world. Welcome to the program, Runcie.
Thank you very much, Dr. Laz.
Yes. Okay, so when you heard that the Cancer Fund has not been released, that the Cancer Fund has been released but not being utilized for cancer patients, how does that make you feel?
Well, I feel really horrible, but before even the outrage from the Senate, we already have known that something like that has happened, long before then, and we've been speaking and asking the Ministry of Health to keep to their word, provide Nigerians a second chance to life. But it was really painful. But we really commend Senator Ibrahim Oloriegbe and the Senate Committee, because this is really important.
Yes,
when
which is part of the oversight functions of the National Assembly.
Exactly. When our leaders do well, we'll tell them they do well and we thank them.
Great.
You know, but it's really unfortunate that the Ministry of Health hasn't been able to give Nigerians a second chance in life, especially cancer patients.
Okay, it's really unfortunate. I had to make a note on that, you know, expressing strong reservations. But let me get to Gloria Okwu via phone. Gloria Okwu is the Vice President in charge of Programs and Communications for the network of persons impacted by cancer in Nigeria. She's a breast cancer survivor, and she's going to be talking from the perspective of how they see this and the recommendations going forward. Hello, Gloria. Welcome to Talking Here with Dr. Laz. How are you doing?
I'm fine. Thank you, Dr. Laz. Good afternoon.
Good evening. Fantastic. Okay, so we are talking about the Cancer Health Fund, the releases that have been made, and the fact that, you know, the 6 teaching hospitals across the country are yet to get these funds to begin to support cancer patients. How does that make you feel as one of those who led advocacy for the provision of this fund, the fact that till now cancer patients are yet to access funds that were in 2020 budget?
It's very unfortunate, you know, being a patient myself and having a lot of colleagues that are really scouting, you know, looking for funds from everywhere, selling their assets, and yet not being able to meet up with the funds they need. It's so sad to know that there is money somewhere that these people could have easily accessed, but for whatever reason they have, these people could not access this fund. So I'm talking to you, I know a lot of women that have died, a lot of men that have died that I know personally from cancer because they could not access funds between last year and this year. So it's really unfortunate that such monies are available, over 700 million, and people have not been able to access it. Honestly, as an advocate, as a patient, I'm really saddened by that development.
Yes, the Federal Ministry of Health said that they are trying to institutionalize the fund. They are trying to get Mr. President to flag off the use of the fund and also get private sector, you know, to contribute more to the fund. Are you satisfied with that excuse that was made for the delay in disbursement of this fund to the patient?
Honestly, I'm not satisfied with that explanation at all. I am not. Because I think once the funds are disbursed, the next thing, once funds are allocated, disbursed, the next thing is to start using them. So I don't know why there have to be a flag off. You know, I'm looking at the urgency of what these funds are meant for. Looking at looking at what cancer can do and what how it hurts people. You know, this should not be up for debate. The time, you know, being wasted for all of this shouldn't even, you know, I'm honestly, I'm not satisfied with the explanation. There is money already. Let this money be released. Already they're working with some private companies. Roche, for instance, I know there are some private companies that are working with them. So if they want to bring other companies on board, it's fine. What we want is more money to be in that, you know, in that coffer for cancer patients. So it's fine. But the one they have now, honestly, I don't see any reason.
So yes, they should get it to the hospitals and
people have not accessed this fund. There's no excuse, honestly.
All right. So has anything changed since the Senate Committee made this public? From what you know from the Federal Ministry of Health, has there been some level of urgency to get these monies to the 6 teaching hospitals where it can be used to support patients?
Okay, yes, there has been a little bit of change since 3 days now. Yes, after the Senate hearing, some people in my network, I heard that they confirmed that they had received a unique ID after registration.
Okay.
And they were asked to report to the Social Services Department, where they will be registered and then proceed to the next step, which I presume should be disbursement of the funds to them so that they can start their treatment. So far, people have been going to the hospital, people have been receiving unique IDs, and they've been going to the Social Services Department. So that is the level at which it is for now.
Okay.
Yes, and that happened after the Senate hearing.
Okay, that's fine. That's really a good news. Thank you very much,
Yes.
Gloria Okwu, for joining
Thank you
us on
very
the
much.
program today.
Yes, you're welcome. Thank you very much.
You're welcome. Okay, coming to you, Runcie, you heard Gloria. I'm so happy that there's been some traction. We really didn't need to wait for this Senate stuff to happen. So just to conclude this conversation, there's a lot of information out there on the eligibility. Every patient, indigent patient with breast cancer, prostate or cervical cancer is eligible. But the selection criteria is not open.
Yeah.
So what do you think about that?
Okay, you see, the process of disbursing, implementing, collating of public fund should be public. This money does not belong to Federal Ministry of Health. This money does not belong to the Senate. This money belongs to Nigerians. So, and if this money is a public money, all the processes involved should be made public.
Right.
I find it really funny when you are actually responsible to disburse public money and you are hiding or concealing the process of, selecting who should, how do you want. So I think the Ministry of Health is already creating an opportunity or a window for people to suspect them. So if you don't want any suspicion, it's always very good to open this. Nigerians will not want to hear that this money is used for buying of project vehicles. Nigeria would not want to hear that this money is used, like 729 million, that they are using 50 million to pay consultants. This is what Nigerians will not want to hear. But from what is happening now, people are already suspecting that because everything is being concealed. It should be open, highly transparent. The same way we've seen all this cash being, cash transfers. It should be open. Like people could even see it on the website. That is how you can get international donors to fund. That is where you can get philanthropists, because they will trust the process. They will be sure that people receiving this money are not allies and friends of people working in the ministry or working in the hospital or being colleagues to CMDs.
Absolutely. You mentioned when we started, there's a private firm that is managing these funds. So this is a public fund. Why having a private organization to manage it?
Well, in all honesty, in my own estimation, I don't think there is I'm not too sure if there is anything bad to get, a private financial solution to manage the process of how the funds and, getting this report and all the systems in check. I don't think that's anything wrong in that.
It's a kind of public-private partnership.
I think it's a public-private partnership. The same thing happening with the cancer, cancer access program for management of drug for a discounted rate, But I think there is also something to really mention here, right? The cancer desk at the Ministry of Health is still too small to manage a disease that kills over 72,000 Nigerians. We need an institute that should manage this disease so that it can be controlled properly, just the same way we control HIV and AIDS.
All right. Thank you very much, Runcie. We're going to take another break. When we return, I'm going to play some Vox Pop on what Nigerian health professionals think about the state of the implementation of the Basic Healthcare Provision Fund. And of course, the recommendations they are making going forward. So, of course, I'll come back to you, Runcie, towards the end to also get your thoughts on that. Do stay with us. We'll be right back.
Well, I think so far it's not very bad, really, in the sense that when you look at the two levels, at the national level as well as the subnational level, you see improvement in the sense that for the state to access the basic healthcare, funds, they needed to put in certain things, on ground, and virtually by now, almost all states have been able, to meet up some of those requirements for them, to access the facilities, while at the federal government level, being, the filer, being the overall, supervisor in terms of release and, what have you, they've not done also too poorly, I would really say.
The implementation, I don't know whether to talk about it generally or to take it state by state. But generally, I can say that I'm disappointed. It hasn't turned out as we expected. You know, the Basic Healthcare Provision Fund is a catalytic fund that is supposed to spur more money to be put in the health sector to primarily save the Nigerian in the area of, especially in the area of health. But now we are struggling with even the Basic Healthcare Provision Fund doing what it's supposed to do, not to talk of it being a catalyst to encourage more money into health.
Since 2014 that the National Health Act was enacted, there was really nothing much done concerning its implementation until 2018 when it was appropriated for by the National Assembly. And from that time till now, there has been a lot of implementation issues around the fund. But for me, I think so much has not really been done, particularly in terms of implementation of the fund. So the states have also, having some roles to play in its implementation, have also not done a lot, to ensure that the fund is fully implemented, particularly at the state level, because it's a state level thing. It's these grassroots people that are meant to really feel the impact of the funding, because it's meant to be used for provision of a basic level of healthcare for people at the community level.
In terms of Basic Care Provision Fund, over this year, since 2014, the National Health Act has been passed into law. There has been efforts to make sure that actually thrives, so it will be a kind of a basement or foundation to strengthen PHCs in Nigeria. And that efforts have not yielded much fruit, in as much as lots of efforts have gone into it from both the government and the private sector. So I think there is a lot that needed to be done still within the system.
Basic Healthcare Provision Fund actually has been largely successful, but then there's a lot of room for improvement, in terms of the continual commitment of states to give the counterpart funding to be able to access the fund, the primary care under one roof, to ensure that primary care centers are administered properly and under the state primary care board or the FCT primary care board. These are all the issues that we are still having to iron out, currently with the Basic Healthcare Provision Fund. But then, largely it has been successful so far.
Implementation. I've said it 3 times because without implementing this, there is no way Nigerians, can really benefit. There's no way we can see an improved health outcome. At the FG level, for instance, since the commencement of the Basic Healthcare Provision Fund, releases has been very poor, I would really say, because only 3 tranches of the fund have been released, so far. First 2 tranches, I think in 2019, and then sometime this year, really, the 3rd tranche, If you consider the budgetary provisions, you see, met from 2019, you see, to date, a lot of billions are there, lying, really, but monies have not really been released, you see, to the states, really. So to that extent, you see that we want to see a situation where the federal government, through the Ministry of Finance, would ensure prompt, release of those funds. And then at the subnational levels, those few states that have not been able, to completely meet up the requirements of assessing the funds, should also, endeavor to ensure that they meet up those requirements.
When there's a budget, I used to celebrate the budget until I realized that the most important part of the budget is the release. So now we have to now focus more on the release. So they have budgeted 550 billion. What are they actually going to release? And based on the pedigree of what was released in the past, we have an idea of what may be released. So the job of CSOs at this time, for me, really, is to make sure that if they have committed, if they have budgeted 50 billion, let us at least start to make enough noise to make sure that 50 billion is released. It's not impossible now.
But I think the onus goes to the states. You know, they have to buckle up. They have a lot to still put in place, you know, to ensure that they fully access the fund, and also the fund is fully implemented, you know, at the state level. And the people who are meant to enjoy the services that are meant to be provided through the fund, you know, start benefiting from that.
One of the key challenges that we see is lack of commitment and privatization of the health sector. So when you talk about prioritizing the health sector, it means that putting them at the forefront, putting health system at the forefront. Because even the economy of the country, the security of the country, all relies on health. So it's he who is healthy that could carry a gun, or also can go to market to buy anything or do any business. So basically, currently, I'm not sure, I will say it clearly, categorically, that governments have not been prioritizing health adequately the way it should be within the country.
Of course, there's a big challenge as to that actualization of that policy, which is our general problem in Nigeria, right? And it is not as though the Basic Healthcare Provision Fund would never be released. It's actually a statutory fund, right, which must be released. The problem now is the timely release of that fund at the time that it can be useful, you know, at primary care centers. And again, how that we can ensure that the money is actually used by the primary care centers in improving themselves, because there's a challenge with autonomy of primary care centers with the governing bodies within their states who, you know, do not allow them to actually use the monies, you know, freely. And then we have cases of perceived corruption, right? But then beyond that, I think that going forward, the government should reinforce their commitment to the basic healthcare, to timely release of basic healthcare provision funds to states, you know, and we also think that the government should actually employ some more use of technology in terms of tracking the results. We need to actually be tying this money to results. We need to be seeing results in reproductive, maternal and child health, you know, in our communities.
Okay, so you heard them right there. So Runcie, coming to you just in conclusive terms now. Yeah. The Basic Healthcare Provision Fund, the impression has not been so good in terms of implementation. So is there any recommendation you have to add, you know, to what many of the persons we've talked to said?
Yeah, so I think it's a lot of the government need to really, you know, own up to some of this feedback. Because the problem we've had in the past is when feedbacks are given, the people working in the government think that other people are antagonizing them. We need to start owning up to this feedback that are coming and think how we can make progress. We all love this country, and that's why we're all here, pushing for this country to be better. My final recommendation will be for us to add cancer screening, basic cancer screening.
Okay, as part of the minimum package of care.
Yes. If you don't add cancer screening, we will continue to lose about 23 women to cervical cancer every single day, continue to lose about 15 men to prostate cancer, and over 30 women to breast cancer every single day. The number of people we've lost to cancer in this year alone is greater than the people we've lost to COVID-19 since 2019.
That's instructive. Thank you very much, Mr. Runcie Chidebe, Executive Director of Project Pink Blue.
Thank you for having me.
All right, and to you for watching the program today, and keep following our programs on YouTube at Talk Health Nigeria TV. We'll see you again, same station, same time next week. We thank all of you, and of course, the production crew for keeping us on the screen all these weeks and months. My name is Dr. Laz Eze. Bye for now.